Hey guys, so I'm going to be talking about the third section of our cholera presentation, which is signs and symptoms. So one of the first things that we have to remember is that cholera is transmitted by dirty water or when a food is contaminated. It can also be if someone has like something on their hands that has the bacteria on it, that can go to the person. And what happens when the cholera gets into your body is it attacks the gastrointestinal tract, which then extracts water and electrolytes out of your body, which gives you extreme dehydration. Electrolytes are pulled from your body. They're excreted in a diarrheal fluid, which then causes more problems. So what I'm going to do is show you guys the signs and the symptoms of cholera. All right, so cholera signs and symptoms. There is a difference that we need to remember between the signs and the symptoms. These signs are what the doctor can see, and symptoms are what the patient can feel. So signs are the things that your doctor is going to check, even so if you have cholera, if you have the flu, if you have those little things, this is what the doctor is going to check when you go in. That'll be like your blood pressure, your heart rate, your lungs, things like that that you see at a normal routine doctor's appointment, but obviously they're a little different for cholera than most. But yeah, then symptoms are what the patient feels. So that's exactly what it means. The things that you are going to feel, like a fever, if you feel like your heart is racing, if you feel restless, things like that. So there's the difference. So the first is the signs, and I will go over that. So first one is a rapid heart rate. Then the next one is loss of skin elasticity. Next one is dry mouth in the nose. And then this next one is a low blood pressure, dehydration, and shock. All right. So we'll start out with rapid heart rate. That one is one of the hardest to explain, but it makes sense. Your body is working so hard to get it back to normal that it has to increase the heart rate to pump more blood. The next one is loss of skin elasticity. It's also called washerwoman hands. This happens when your skin loses the elasticity. So you look back at your skin, it bounces back automatically like that. When you get older, you lose this also because you lose more water. And it also happens when you're washing your hands. That's why it's called that. And you get really pruny. That's okay, that. Next is the dry mouth and the nose. That happens because you're having less water in your body, and so it's not able to produce the proper lubrication for your nose, the saliva in your mouth. Next is a low blood pressure. This happens because your blood now, because you have the virus in you, is creating less water, less plasma, means more red blood cells, and it means it's harder to pump through as you go along. The next thing is dehydration. That's kind of an obvious one. That happens whenever you're doing anything that you're losing water. Even like working out, you get dehydrated. But when you're obviously have diarrhea, vomiting, you're going to have so much more, and it's going to cause a lot more problems for you. It can sometimes even be fatal if it's not treated. And the last one is shock. That's an extreme case of happening when it's not treated, and that's what happens. Next, we'll go back to screen and we'll talk about symptoms. So symptoms are, as I said before, what the patient feels. First one is vomiting and diarrhea. Second one is thirst. Next one is muscle cramps. And the fourth one is restlessness. And the fifth one is irritability. And these symptoms can show up from a few hours after you're infected to 5 days. So it usually is around 2 to 3 days, but it can range from any of those. The first one is vomiting and diarrhea. That one is the most obvious sign, the sign that you should get treated for cholera if it is an extreme amount that you're losing a lot of fluid in your body. That happens the most frequent, and all the other things kind of occur after. The second one is thirst. That happens because your body needs to replace that water that you were losing. So that happens. Muscle cramps is the third one. It occurs because your body does not have enough water in the muscles, so they're becoming tighter, and you need that electrolytes and that water to keep your muscle systems going, so it's harder for them to work through. The fourth one is restlessness. This occurs sometimes because of muscle cramps. It can go hand in hand. It also makes your muscles and your heart, it can occur from your heart rate increasing, so you can't sleep as well. You have cramps in your legs, which makes you more tired. And the last one is irritability. This one is one of the more obvious ones too. You can feel irritable when you're having all these problems, and that's when you feel not good. So I will leave it off there. Next, Chris is going to be talking about transmission and how to make this go away.